Okay, so there are two kinds of kidney doctors: kidney surgeons and then medical doctors of the kidneys, urologists and nephrologists. Let's talk about some of the differences between those specialties. Stay tuned. Hey guys, Dr. Segal here. So the question is, I thought my urologist is a kidney doctor. Why are they sending me to a nephrologist? So let's get into the details for why you might need to see a nephrologist. At the end, I'll tell you the most common reason why in our practice we'll send patients to a nephrologist. So stay tuned for that pearl of wisdom at the end. So I think one of the easiest ways to think about this division in medical specialties is that nephrologists focus on the health of the kidney. Okay, so what medications are good and bad for the kidney. They certainly handle dialysis. They manage medical conditions or medical problems of the kidney itself. Whereas the urologist, first of all, we operate in the entire urinary tract. So we do surgery of the kidney, the tube that drains urine from the kidney down to the bladder called the ureter, the bladder, below the bladder, the prostate, urethra. We do all that surgery. Nephrologists don't do that surgery. So that's one thing. And then we deal with medical conditions of the urinary tract kind of below the kidney, right? So if there's a problem with the ureters, a problem with the way the bladder works, a problem with an enlarged prostate, a problem with the urethra, anything in the scrotum or the genitourinary tract for sure, that's what we deal with. So I think that's kind of a way that you can think about the differences. Nephrologists are medical doctors of the kidney. We deal with medical problems of the urinary tract below the kidney, and we do all the surgery in the urinary tract. So then the question is that we get is what are the circumstances or the reasons why a urologist would need to send somebody to a nephrologist? So I'm going to list some of those. Okay. So sometimes, if I take somebody's kidney out because they had a kidney cancer and their kidney function doesn't go back down to normal and they want to kind of talk about ways they can keep their remaining kidney healthy, we'll send them to a nephrologist to have that conversation and go through those details. If we do a blood in the urine workup, and we have another video on that, so you can check that out. But if we do a blood in the urine workup and that workup is stone cold normal, and we're saying, you know what, we don't see anything, oftentimes we'll do a referral to the nephrologist to see if there's anything abnormal with the kidneys themselves causing that individual to shed red blood cells in the urine. So after a negative blood in the urine workup. So sometimes we'll diagnose somebody with kidney failure, the urologist will, for a variety of reasons, but sometimes it's because of an obstruction. So if there's an obstruction of the ureters, okay, then there'll be swelling of the kidneys. Now that obstruction can be further down if it's because of the prostate, and we have a whole other series on that. Then the kidney function will be abnormal. All right, because that's not good for the kidneys if urine can't get out of the kidneys. Sometimes we'll fix that obstruction. We'll place stents, we'll get rid of stones, we'll treat the prostate obstruction, and the kidney function's still abnormal. All right, so now we think there may be a problem also with the kidney itself. Then we'll do a referral to a nephrologist, the kidney doctor. Okay, so in situations where we fix what we think is the cause for the kidney damage, an obstructive cause, and there's still remaining kidney damage for whatever reason, then we'll send them to a nephrologist. Sometimes I've worked people up and I'm trying to figure out why they're having problems urinating, and we'll notice some abnormality on their urine specimen. That means that they could have a metabolic cause or a problem with the way their urine is concentrating, causing the urinating issues. For situations like that, the urologist will send a patient to a nephrologist. We go to a urologist office, almost always we will check your urine for a variety of things, and sometimes we'll detect protein in the urine. Protein in the urine can be a sign that you have problems with your kidney, and if we detect it, incidentally, oftentimes we'll send you over to your primary care doctor or a nephrologist to figure out whether you truly have kidney problems or not. So incidental findings on urinalysis, that's another reason why. And the most common, so this is my pearl of wisdom, kind of the most common reason why, at least I do in our practice, we will send patients to the nephrologist, and I have no problem admitting this. Nephrologists are, in general, better than me and better than a lot of urologists at figuring out why patients form stones, right? So if I diagnose somebody with a stone, I do surgery on them, get rid of the stone, problem solved. and they keep making stones, or they say, "Doc, that was the worst thing in my life. I don't want to ever have stones again. How can I stop making stones?" We can certainly do a workup for that, but nephrologists are much more expert at doing a detailed workup, all the interpretation of it, figuring out whether you need to be on a medication to not form stones, dietary recommendations, etc. They just do more of it, and oftentimes they have a little bit more time to kind of delve into that. So that's probably the number one reason why a urologist, at least in our practice, will send a patient to a nephrologist. So hopefully that gives you some insight as to the division between urology and nephrology. Thank you so much for listening. We certainly appreciate it. Please subscribe to our channel. We release at least 2 new videos a week. Thank you so much.